Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, so recently, Dell Bigtree pulled back the curtain on the vaccine industry and medical freedom. The response was massive and divisive. Some of you felt validated, some of you felt scared. And a lot of you asked, okay, so what do I actually do with this information? I still have to take my kid to the pediatrician. I still have to make decisions. What now? So today we're bringing you the other side of this conversation, not an activist, but a practicing pediatrician who's in the exam room every single day with real families making real decisions. Dr. Joel Gator Warsh is a board certified Los Angeles-based pediatrician, and he wrote the book that pediatricians are too afraid to write. That book is called Between a Shot and a Hard Place, where Dr. Warsh's goals, as he put it, is not simply to argue for or against vaccination, but rather to empower parents with information so they can make informed decisions for their families. I believe that this conversation and others like it are vitally important, not only for the health and well-being of our children, but also to our society as a whole. So without further ado, Dr. Warsh, thank you for taking time and thank you for joining the show today.
Thank you for having me on again.
Absolutely, man. So I think the majority of my audience probably knows you pretty well. And like I said, you've been on before, but can you kind of walk us through a little bit of, your journey? How did you start out as a pediatrician? How did you end up in this integrative pediatric practice that you are now so that everyone kind of understands, your journey?
Yeah, so I did all the regular medical training. I trained med school in Philadelphia at Thomas Jefferson, and then I did my pediatrics training in Children's Hospital Los Angeles. So, super fantastic Western program. Children's Hospital is one of the top 5 programs in the country and very Western. And that was kind of my training. So it wasn't really very naturally minded, I guess I would say. Growing up, I ate pretty healthy and played lots of sports and, did all the regular things, but I wasn't particularly health conscious, I would say. But during training, I met my wife, or now wife, who is very holistic minded, and it did open up my eyes to a different world and to a different perspective on things. And I was really just very interested in that as I started to learn about it. When you're in training, especially somewhere like Children's Hospital or regular medical program, anything that really is about natural is kind of woo-woo and out there, and that's all you really hear. And you don't really think much more about it. I mean, even something like chiropractics or cranial stimulation, all those things are just kind of like, the other,
right.
Like not science-based, right? And that's kind of what you hear. You don't really think anything else of it. But as I started to look into things, as I started to research things a little bit, I was like, this is really interesting. And then I did a functional medicine course. And when I was sitting there, I was like, why are we not learning this? Like, there's nothing woo-woo about this at all. I mean, obviously integrative stuff you can get way out there, but functional medicine, root cause, thinking about diet, nutrition, exercise, like none of that's woo. That's obviously like very common sense, most important stuff we should be learning, and we're not. So I just got really interested because I thought it was really very practical and useful for my future career. And so I started learning a lot more in integrative medicine, have been practicing and kind of integrated those two together. And I'm not against modern medicine, in practice we'll do medication if we need it. I just feel like we should balance both worlds and have been trying to do that now for about a decade. But as it relates to vaccines, you learn very quickly once you get out into the real world in practice, and you're doing integrative medicine and all, that people have a lot of questions about vaccines in that space. And I really wasn't taught all that much, I realize, about vaccines. I mean, we learn about the diseases and how horrible they used to be and how many fewer cases we have now and the vaccines that we have and how amazing they are. And, here's your schedule. Yay, go do it. And that's really all you think about it. You don't really think anything else of it because that's what you're trained, and they're just so great. And you're taught to go do them. And as I was in practice, I was getting more and more questions, more and more good questions. And I didn't know the answers, and I didn't understand a lot of what I was being asked. So I had to learn and had to research about it. And the more that you read, the more I would say interesting that it becomes, and the more you realize what we really don't know. And even the things that you're taught are not necessarily totally true. But you also have seen over the last decade that it was really censored as a topic. So it wasn't something you could really talk about on online. And that was really frustrating. And certainly during the pandemic, it was very, very frustrating. So that's what, when I was so frustrated during the pandemic, I decided I was going to write a book and I was going to do a deep dive if I wanted to talk about it, because I did want to talk about it. I really wanted to have discussions. I'm not against vaccines. I just think that we should be having discussions about them, and we should be open to having conversations, and parents should be able to talk about these things and express their concerns. So that's what really led me to write the book. And I guess thankfully now we're in a little different place and it's not so censored and you can have these conversations, which has been wonderful. And when I wrote the book, I wasn't sure if I was going to lose my license. I wasn't sure, if I was going to get tons of hate. Thankfully, I haven't. And it's been great so far. And people are super open to talking about it. And it's a different time. So that's great. So that's what got me here now.
Yeah. Well, and, just to kind of talk about your book a little bit, right? I number one, I really appreciate that you did have the courage to write it. I love your balanced approach that you took to it. I actually loved the historical perspective. You really did a great job of going through the history of vaccines. I personally like to do that when I teach functional neurology, right? I know it's a completely different mindset, different topic or whatnot, but I think that we need to understand where we came from in order to understand where we're going. So I really appreciated that. I guess one question I have for you, what was it? Was there like a decisive moment? Was there like something that happened? Like what made you really start to question the safety, the efficacy of vaccines? Like was that just a momentary thing, or was that just a lingering question that had been brewing in you?
I don't think there was any one specific moment. I think it's the accumulation of questions and concerns that parents had over the years, and just not being able to find answers for things and things not making sense. And certainly what pushed me over the edge was COVID and kind of safe and effective, and the way that things were being forced and not counting natural immunity. There were just so many things during COVID that made absolutely no sense. To anybody who's done science before, it was like, natural immunity obviously counts. Like it always counted. So why are we discounting it now, or forcing people to do something that's new that we don't have any research on long term? Just didn't make any sense. And so I think that really pushed me over the edge. Like, what is going on here? Like, we've heard, I think people that are in this space and like they've heard stuff about vaccines. I think for most people, adults, they don't really think about it at all unless they have kids. And at least until COVID, like it just wasn't something that was really on most people's minds anymore. And the more questions I got, the more I looked into it, the more questions I had. And being somebody who has to talk about vaccines and potentially give vaccines every single day in the office, like I felt like it's something I need to be educated on. And I don't understand so many things, and I can't find what I feel like should be there. Like you're taught certain things about the research and the safety and how they were done, and you're like, I can't find it. So like, am I missing something? Like some of these things just have to be wrong. And I had to do that research to be able to at least provide the most informed consent that I could for products. And I still think there's just a lot that we don't know, but at least you can give people as informed consent as you can. And to me, the goal with the book is to open up discussion, because I think there are things that we must do to get to the answers that we have not done in terms of the research. And we're never going to do that unless there's acknowledgement of what we haven't done thus far and what we don't know. And I think medicine is not doing that. Like we're just saying, oh, they're just safe. We know that. And I don't think that we do. Like, I don't think we have that research long-term to say yes or no.
Agreed. I love how you just outlined, as a pediatrician, who is the gatekeeper, the one that's supposed to be, recommending what vaccines and when, and, monitoring childhood health status and all of these things. You said there were questions that needed to be answered, and you just had to find those answers, and they weren't there. So as a practicing pediatrician, when you could not find those answers, how did that make you feel? Just on a personal level, philosophical level, professional level? Was it just completely like obliterating to your whole mindset? Like, what did that do to your concept of practicing medicine?
I mean, it just makes you confused, I think. It makes you confused about how to answer the questions appropriately, how to give true informed consent when you don't even know the answer to some of the questions that you're getting. And I think for me, there's, again, I think if there was one moment, it'd be something different, but because it was kind of a slow trickle, like nothing that, I've seen lately really surprises me about anything. It seems like there's all sorts of craziness and all sorts of topics. So I think that it's just confusing when we're trying to make recommendations to help kids and to prevent illness and to make kids as healthy as possible. And it seems like the goal in medicine these days is to prescribe more and to do more vaccines is always better. And I don't think that makes a lot of sense. Like the goal is not more vaccines. The goal is healthier kids.
Yes.
And it seems like if you want to call it two sides, let's say, I think most people are in the middle, but you'd have the very, very pro-vaccine people and the very, very, I would say, anti-vaccine individuals, and they're having two different conversations that never connect, and you never really see debate between those worlds. But it's just, there's like one world of like, the vaccines work, they have great benefit, they protect you from diseases, go do vaccines. And there's no discussion about the risks from vaccines, and it's not part of the equation. And then in the air quotes anti-vax worlds, like vaccines just cause so much harm and they cause so much damage, and there's no discussion about the benefits and who it might actually help. And those two worlds don't collide, and they're just out there. And that's not beneficial to most parents that actually have to make a decision, that might be forced to do it for school. They have to decide, like, what is the risk that I should be taking? Should I be taking the risk from nature? Should I be taking the risk from the vaccine? What's the risk from a vaccine? How is this going to cause long-term harm? Am I crazy for letting my kid be exposed to measles and not giving the vaccine? Like, what am I supposed to think as a parent? It's so confusing. And it's more confusing than ever, certainly with discourse today, but at least there is some discourse.
Sure. I do always point out, when I'm talking to either side, right? Because, I'm coming in contact with both sides. The goal of both sides, whether you're one of those, super pro-vaccine person or super anti-vaccine patient, the goal is the same, is to have a healthy, safe child, right? And I think that if both sides were to acknowledge that, right, we have the same goal. Let's discuss how we can really work together, because you're right, the goal is to have safety. The goal is to have healthier kids, which we can get into later. We're tracking the data. We don't have healthier kids. It's actually going the opposite direction at this point in time. But I'm actually curious, because you've brought up COVID several times. Have you seen the research put out by Kevin McKiernan's team? So he's put out, he's researched what is actually in this COVID vaccine, and they're finding DNA fragments, SV40 promoters, and those types of things. That was, to me, that was kind of frightening to see that those things were in the vaccine. What are your thoughts on that?
I mean, the ingredients in vaccines, I think, are a much bigger topic and concern level than practitioners kind of give it in modern medicine. I mean, it's literally all you ever hear is, it's just a small amount of, including ingredient X, like a small amount of alumina, a small amount of formaldehyde, a small amount of this, it's fine, and that's all that you hear. And you really don't get a lot of discussion on how this might be affecting certain individuals, how it might affect certain kids with genetics that are not as good at detoxing. It's like you have a peanut, you walk by a whiff, you have a whiff of it, and some kids go into full anaphylaxis. So a small amount is not the full argument. Like, I think everybody's different. Mm-hmm. And with the COVID vaccines, I mean, if it is true that there are a lot of ingredients in there that aren't supposed to be in there, obviously that's concerning, right? I mean, that should be concerning about any vaccine, but I'm sure if you studied any of the vaccines, you probably find stuff in there that you wouldn't expect to be in there. I mean, anything that's mass produced like that from multiple different places, who knows, what's going to be in it, what the batch to batch variation is. It's supposed to be the same, but I highly doubt that it's, totally exactly the same. I'm sure you get a little more alumina in some vaccines, a little bit less. I'm sure it's not perfect, but what the safe levels are, where they're supposed to be exactly, I mean, you'd have to study it, right? We have some research, but you certainly are never studying kids vaccinated versus unvaccinated. You're not studying these things long term. It's really complicated to research any of this because there's so many factors that go into it, but you certainly don't even have the basic research that you need to look into cumulative health and cumulative safety of vaccinated versus unvaccinated kids. So we can't even start there, and I think that's the next step that needs to be done. I mean, if I always get asked, like, well, what's the biggest thing that shocked me? And I would say overall, it's the lack of long-term research. Like, you would think these things were studied a lot in the long term, but they're really not. Research is really almost all before they hit the market. I mean, certainly there's some epidemiologic studies after, but you don't have vaccinated versus unvaccinated studies, so you really don't know what happens long term. You can't tell if an unvaccinated child has a lower risk of some of these chronic conditions. And that may have mattered less 100 years ago or 75 years ago or whenever, when there were more infections and people were dying from infections all the time. But that's not what's going on anymore. We live in a different world, and chronic disease is such a huge issue right now. And so it is a reasonable question to say, how are vaccines related to chronic disease if they are? And the only way to really know that is to do the prospective trials that you would need to do. You can't rely on epidemiology. They can only get you so far because epidemiology is so biased. And that's why I think you see pro-vaccine people finding very pro-vaccine outcomes for epidemiologic studies on vaccines, and then anti-vaccine people finding really, bad results for vaccines. And it's really tough to know what's correct. And the way to figure that out is to do the proper trials, to do a prospective trial, to follow kids forward, to see if kids are truly healthier if they're unvaccinated from chronic conditions. But it still complicates things because you also have to take into account after that fact, the infections. Like if everyone stops vaccinating, some of these diseases are going to come back, and that could cause lots of issues too, potentially. So you have to weigh those two things, but you first have to figure out what kind of problems the vaccines might be causing to even be able to identify what your risks are, and then also to try to make them better. Like if you could identify what might be going on or how things might be related, you could potentially make a vaccine better, still work, but make it have less side effects. Like that's the way we should be looking at things, I think.
Yeah, no, totally agree with that. That's, again, if the goal is truly to have, a safer option to make kids healthier, that's what we should be looking for. Absolutely. So just to ask very clearly, so, the audience can understand this. So have there ever been any fully randomized placebo-controlled studies on vaccines? And I'm talking about the kind that use an inactive placebo instead of, let's say, another vaccine, right?
Yeah, no, I mean, we have not had long-term unvaccinated versus vaccinated studies, even retrospective, not really, but certainly not prospective. So we don't have the kind of studies that you would need to really be able to look at this in a definitive way. There are absolutely epidemiologic studies. Still, epidemiology is really not vaccinated versus unvaccinated, but you do have some. When they say that there's an unvaccinated versus vaccinated, what it really is you're looking at one vaccine. So let's say MMR, measles, mumps, rubella. It's like kids that got MMR versus kids that didn't get MMR in the setting of getting your other vaccines. So it's not that that's a useless study. It's still very useful, but it's not answering the question, which I think parents have at the root of it, is, are unvaccinated kids at lower risk of chronic disease? And that's a really important question, because to me, that's the missing piece of the puzzle right now to really being able to make a calculation of your risk versus benefits. Because if you were to say, well, if you take a vaccine and it has no risks in it and you only just prevent a disease, well, that's a good thing. Then, I can pretty easily recommend to a parent, I could say, well, there's really no risk. It's not going to cause any problems for you, and your kid's never going to get measles. So, I think that's a good benefit. But if it increases your risk of asthma or allergies or autism or autoimmune conditions or whatever it is, then the question is by how much and how many? And that matters, because if you're saying, well, yeah, it decreases your chance of having bad measles. So one in, I don't know, let's say 100,000, but 1 in 10 kids are going to have an autoimmune condition from this thing, then that's not a good weight calculation, right? It has to be a better benefit than there is a risk. So you have to know what that risk is.
Yeah, absolutely. So if we don't have that type of study, I don't understand, why can we just not do vaccine versus placebo? Why do they have to do vaccine versus a different version of the vaccine? The only conclusion, the only answer I've been able to find is, well, it's an ethical concern, right? If we know that this is going to help prevent the disease, then why would we withhold that in a control group? Like, that's the only, discussion that's been around that. Like, why won't they just do the freaking study?
Well, there's an ethics around a vaccine that's already on the market. So the ethical concern really comes in if you're saying, well, we've had a vaccine on the market for a while. We know that it works. So we can't just study unvaccinated kids, because then you're not giving the vaccine that we know works to a bunch of kids, and that's unethical. So that's where that unethical scenario comes from. And you can debate that, but at least I understand that makes some sense. So we can just kind of leave it there. The problem is there should be no ethics around when you're bringing a new vaccine out for the first time, or any medical product. you should always have to study that against an inert placebo. That should be the baseline. So you have a baseline to look at the safety. Now, for a lot of vaccines, that was never done. So we're in a predicament now because they never did it against a baseline of a placebo, inert placebo. And now we have these things that have been on the market for 10, 20, 30 years. And so you can't do that study ethically because they're on the market, but it wasn't done originally. So the first thing we have to do is to say, as a rule, we're never going to let anything on the market again unless you do those studies, right? Anything that's completely new, we have nothing on the market for. If you're going to make a new vaccine completely for a new disease, if you're ever going to get it on the market, it should be required to have an inert placebo study or many studies before. Like, there should be nothing that's unethical or even debatable about that. I mean, I was shocked that this stuff hasn't been done. You would think it was. If you're injecting something into a newborn baby, you would think, oh, they would have studied against a placebo with 100,000 kids before they're injecting into babies. But lo and behold, we're giving Hep B based on trials where it was in 100 kids and they studied safety for 5 days. Like, it's insanity. And that's not to say that the Hep B vaccine is unsafe or is causing problems. We don't know because they never studied it appropriately, but it should be the standard that we require it. So yes. I think moving forward, like, there's nothing anti-science. I don't want to inject something or give something to my baby unless you've studied it extensively and can show that it's safe. Like, how is that unscientific? That's science. Right? So I don't think that should be debatable. It also shouldn't be debatable that we could do vaccinated versus unvaccinated studies looking retrospectively at the data that we already have. Like, that's really easy to do, and it should be done on many different databases. And we should be able to do studies going forward where people choose which group they're in. So there's nothing unethical about saying, all right, we're going to do a study. We're going to follow you forward. You can choose if you want to get a vaccine or not get a vaccine. If you're not going to get vaccines anyways, there are plenty of people that would volunteer for that study. If you change your mind, you want to get vaccines in the future, go for it. We're not going to stop you. There's nothing unethical about that either. So that's what we should be doing, I think.
Absolutely. So I have to ask you, right? There's one study, one report I want to ask you about, right? So we have the Henry Ford Health Science study that was released, and that was the center of Del Bigtree's documentary, An Inconvenient Study, right? And then we also had here recently, we have the McCullough report that came out, which is not a study, really just looking at 126 different publications, I think. What are your thoughts on these two items?
Yeah, I mean, the two pretty different scenarios. So let's start with the Henry Ford study. I would say that's the most important research in vaccines to date. I think it's really important, especially because they were able to get the hidden camera footage. I think that's really helpful to understand what's happened in the vaccine world. I mean, this is what I suspected happened. I think this is what anybody that really looks into it kind of comes to the conclusion that the research isn't all there because it wasn't done or was hidden, or people just were too concerned to do it. But this kind of proved it on camera. Like, I think it's really interesting to watch this guy who's very pro-vaccine, who's not really seemingly against kind of controversy. Like, he was involved in several controversial things before then. He does this study. In my mind, from what I've seen, it's a very good study. It's done extremely well. It's about as good as any other study has been done on vaccines. They come up with results that he was surprised to find, which to me is really important because, usually have a pro-vaccine person finding a pro-vaccine outcome. And this is someone who's super pro-vaccine who finds things that he didn't expect to find. And so I think that's really valuable. And then you watch him say that he didn't want to publish it, right? He didn't want to publish it. He was afraid for his career. And he's right. Like, he's right. He probably would have gotten destroyed after that study came out. But ultimately, this is research that was done. It was good research. It should have been published. And we don't have this great study that could have pointed to the fact that maybe there are some issues with long-term chronic health from vaccines. And no one study is perfect. Maybe the data is bad. Maybe there's some reason, whatever, they didn't control things properly. But this is good information to say, look, here's what we're finding. Let's replicate this. Let's see if it holds true. Let's do it at Kaiser. Let's do it at Harvard. Let's do it other places. Let's see what we can find. Because if all the studies are showing the same thing, well, that's concerning that we're having increased risk of chronic conditions from the vaccinated kids. And now we do really have to do a prospective trial to see if this is true or why this is happening so we can figure out what's going on. So that study is very, very important. And I'm glad that it has come to light now because I think it's just been unclear for a while, like what's going on with that research. And that makes it very, very clear that like people are just too afraid to do it. And if they do find something, they don't publish it. And so you only get one side of the research, not the other. And that's not to say, again, that vaccines cause a problem. I'm saying we don't have the side of the research that maybe shows where it might cause issues. And so we don't have an honest debate and an honest, I think, accumulation of research that we really need to be able to move forward. We need that research that's unbiased.
Right. So why this, this isn't a new study, right? It's been out for a while. Now it's not been published, but why hasn't it been widely accepted by providers? I mean, it's been, accessible. So why haven't doctors taken it and been like, hey, why aren't we publishing this? Why is no one raising flags? Why is no one drawing attention to it? Right? It just kind of has sat there for years.
I mean, I think that, originally it wasn't out there, so no one probably knew about it. And then even now after this, it's still not published. So most doctors wouldn't even be aware of it. Most doctors don't.
So just
don't
accessibility concerns.
Yeah, they don't follow Del Bigtree or, the High Wire or other things like that. Sure. I mean, he's kind of seen as an out there kook, in medicine, right? He always was. He was part of that RFK, crazy crew or whatever you want to call them from the past. And so anything that they do is just anti-vaxxers, whatever, they're crazy. So they're not going to see any of that. And even if they did see it, they would say, it's unpublished. It's no good. It was unpublished because the research is bad. They're never going to actually look at the study or watch the video or have any clue about it. So I think that's the way that it kind of, why it's not more popular or why it's not really known is because it's just not a disseminated study in a big journal. And that's what doctors see.
Yeah, no, I can understand. That's the standard of medicine. I get that. So let's compare and contrast that to the McCullough report.
Yeah, I think the McCullough report's very different. I think, to me, that has been way blown out of proportion in terms of its usefulness. I think, I looked at it, I read through it. I think it's very good in terms of they were thorough, they spent time, they put together a report, but it's basically like an article in a magazine. It's not research, not really. And I think it's the conclusions that people are drawing or the discussion that people are having on it is way out of proportion. It's a group of individuals that have a perspective. They're putting that together. They're choosing their research that they want to discuss. A lot of the things in there aren't even published studies and things like that. So stuff that kind of goes with their narrative, and they're packaging it together and discussing it. I think it's good in the fact that they're talking about autism, they're talking about multifactorial reasons behind autism. They're going through the vaccine research on autism, which is really useful because it's something that's been censored for so long. And I think it needs to be out there. But it really is just a packaged bunch of information of people who are quite biased in that subject and not presenting both sides in any sort of way. And it's being presented. I don't even think they're necessarily presenting in that way, but people have taken and been like, the McCullough report, the analysis, the study. And it's not really any of that. It's just really a summary of research in terms of their kind of narrative of what they feel like is going on. And it really kind of disregards the other research that has been done. And I wouldn't say the research on autism is good. It's terrible. But there still is plenty of research out there that shows that vaccines don't cause autism. So you have to include that too. And you can say why you don't agree with that research or why that research is biased or why that research hasn't looked in the right way, which it hasn't. I mean, it really just studied MMR and thimerosal. So we don't actually know. But it's really just kind of a biased view from the other side. And so I think it's good as a counterbalance to all the research that's out there. But it's not really a study in any way. It's not controlled. It's not a meta-analysis. They're not combining things in any way. They're not looking at effect sizes. They are including things that are small as the same as something that's big or something that's done better. So it's just more of a narrative. And that's fine. There's nothing wrong with it. I think it's fine as a narrative. It's just not research or a study. It's just imagine someone put an article in the Atlantic or the New York Times or whatever, and they synthesize. That's what they did. They just synthesized the research and they put a lot of effort into it. So I think it's great, but not science.
Right. We need to take it for what it is. Right. I mean, and unfortunately, a lot of people don't know how to read this information and take it for what it is. So it's good to hear from you about how to do that. Can we talk a little bit about liability shielding? Right. So since 1986, if you get injured by a vaccine, you're not actually able to sue the vaccine manufacturer. You actually have to go to a federal court, petition for the National Vaccine Injury Compensation Fund. That's concerning for me, right? So I'm obviously, we have to carry malpractice insurance, but then I also have, I manufacture lasers, right? The therapeutic lasers. And when we're manufacturing and designing our lasers, we have to test each component part according to FDA standards, even the electronics, the optics, even the casing, like everything has to be individually tested and then tested as a whole, collectively as a system. But still, if I injure, if that device supposedly injured someone, I'm liable. This is true for every product out there, right? So it concerns me that that's not the case for vaccines since 1986. Can you give us some narrative on that?
Yeah, it's another big piece of the puzzle that I think is really interesting and unique and concerning when it comes to vaccines that just most people wouldn't know. I mean, I certainly didn't know it, right? Until you start to learn about these things. And so I don't think most doctors really do know any of this. And it matters when you're talking about having one product that's different than all the rest. And when you talk about like a country like America and capitalist society, one of the big checks and balances is being able to be sued. And that's really one of the big factors here. When you have a pharma company, they'll study a medication for 5 or 10 years because they want to see if anything long-term happens, because they don't want to get sued for billions of dollars or anything that's made here. You don't want to get sued. So you want to make sure your product is as good as possible. And if it does start causing problems, you either have to take it off the market or you have to change it because otherwise you'll keep getting sued. So that's really one of the major checks and balances we have in our society. And for vaccines, we don't have that. So you have a situation in the 80s where there were so many lawsuits that companies were just deciding that it wasn't worth it anymore to make vaccines. They were too concerned they weren't going to make money, so they just dropped out of making vaccines. And the rest of them were considering it. And the solution at that time was, well, we want vaccines, so therefore we need to give them a liability shield. And so they enacted the Vaccine Liability Shield in 1986. And from then on, you see the government, if you are going to sue, basically you can't sue them. I mean, there are a few exceptions, but mostly you can't sue them. And that's where we sit today. And so what you get with that scenario is a product that once it hits the market, you have all the marketing done for you by doctors and CDC and FDA. You have it's automatic kind of, everybody needs to get it. So there's a huge market for it. They don't have to really do anything. And there's no liability, so you can't sue them. So they have a lot of incentive to get them on the market. They have no incentive to make them better. They don't have to care about safety other than like you take it and everybody just dies the next day. Then, maybe it's not going to get on the market, but they don't need to really care about safety other than to get it past the review. And so they have every reason to lie, cheat, change the research, not look for things. They have every reason not to look for safety. And it's not nefarious. It's just if you don't have to be sued, then if you don't find a problem, then the problem doesn't exist. And they can say it's safe if they never found it. And I think that's where we are today, where you have all these studies where they studied against a non-inert placebo against another vaccine. You're looking at relative safety. You're finding out things later. They're not long-term. So there's no push to find things before. And then there's nobody looking after. And so anyone that says, oh, well, we have a problem, they say, no, it's not to do with the vaccine. Or if you do relate it to a vaccine, which is still very rare because there's not that much you can sue them for in terms of the government, then it just goes to the government just pays and that's it. And it doesn't have anything to do with the company. So it's a really bad situation for our health, I would say, in terms of having the best possible vaccines and making them better, because there is no incentive to make them better.
Yeah. I mean, the market's lined up to generate a lot of revenue. And that's what it seems like, right? This is a revenue making machine, especially when you shield from liability like that. It's concerning. And I hope it changes, right? It needs to change because that's how a capitalist market protects, the society, one of the mechanisms. And I know that's arguable. And I know people would probably message me about that statement, but that's fine. So I do have a question. So when you were researching, you were writing your book, were there any things that you uncovered that you're like, holy smokes, I had no idea. This is huge, like mind-blowing information that you uncovered for yourself?
I would say by far the most mind-blowing was the research on autism and vaccines. We're taught that vaccines don't cause autism. We're taught that the research is debunked, the science is settled. I mean, those are all the buzzwords we've heard for a long time. And again, it's like, that's all you really learn in med school. Like you just, anti-vaxxers are crazy. We have so much research, so much science, no link. We know that. And so that's what you really take with you. And you don't really look at it yourself. And when I looked into the research, I mean, it's just so shocking how little there is. and how specific that research is. I mean, there certainly is research on MMR, and there certainly is research on thimerosal, but there's no studies on all vaccines versus no vaccines. There's no studies on all the other vaccines, following them forward. So how can you possibly say that? I mean, doctors just don't know. I mean, I didn't know. And you can't say that vaccines do or do not cause autism based on the research that we have, because it hasn't been studied appropriately. But there's so many other vaccines that we haven't studied yet. So to say that it's so categorically can't be related to autism doesn't make any sense. Like, you have to study it first. And there's so many vaccines we give in the first year that are not MMR. So I don't know how you can make that conclusion. I mean, it's really just a conclusion of, we don't have any research that shows that vaccines cause autism, therefore vaccines don't cause autism. And it's like, well, if you don't look, you're not going to find. So if you don't look, then you can say it doesn't cause it. That's not, the answer is we don't know, not no. Like, the answer is we don't know, therefore we need to do that research. And that is completely shocking to me, but and I didn't believe it. Like, I could not believe it. I thought I had to be doing something wrong when I was searching. I kept searching, and when I couldn't find anything, then I started reading books. I mean, I was reading some books, but like, I was like, oh, I got to pick up the big books that talk about autism, and like, look at Paul Offit's book and look at Peter Hotez's book and all these people that are super pro-vaccine, and like, okay, they must have more research that I can't find. And they just point to the same studies. So there isn't more than what I found. It's just, we haven't really studied the question, not really. So it's actually like a crazy, crazy thing to me that we so definitively say that, when it's just not true. And I think if most people knew that, they wouldn't be so against getting more research, and maybe we could actually look into this. And maybe if they did the right research, it would show that vaccines don't cause autism. I don't know. We need to do prospective studies to look at that. But we can't say so definitively. In no way can we say that.
Sure. I mean, so my fellowship is developmental functional neurology. So, I mean, my focus, especially early in my career, was heavy neurodevelopmental disorders. I've seen a large amount of autism cases, continue to see a large amount of autism cases. And I'm sure you hear the same thing. I'll have a parent crying in front of me that they say, I had a normal kid until, right, they received X, Y, or Z vaccine. Now, I can tell you that's played out hundreds, if not thousands of times over my career. Again, that's a heavy focus in my practice. But then I also have, I'll say, a handful of autistic children, and they've never been vaccinated, right? So that's data. That's something that we need to pay attention to, because there's no smoking gun to autism, right? This is a multifactorial situation. What are your thoughts on, like, what's really driving autism? These rates, like, they're going insane. They're skyrocketing. And I know that diagnosis has changed. I know that, I think it was last year they took away the diagnosis of PDD and OS, right? And so they're kind of forcing you to diagnose either autism or cognitive delay or global delay, which I didn't like that. I like the PDD and OS for certain kids. But so I know that those are factors, but what are your thoughts? Like, what's really behind the issue here?
Yeah, I mean, you summarize it really well. And I think for me, the frustrating part with this is that we haven't even acknowledged at this point that it's increasing, or that, like, I mean, I think a little bit now, but like for so long, it was like, no, we're just better at diagnosing. And so there wasn't a lot of research into what's going on. Why is autism rising? What are the factors? And just until maybe this last couple months, we were barely talking about it. It wasn't something that was out there. So the answer is we don't know, right? We don't know what's driving this. I think, like you said, there's no question that some part of it is diagnosis. I mean, we're certainly much better at diagnosing it. We're much more aware of it. People are talking about it a lot more. Doctors are much more aware of it. You get a lot more services, for free or covered if you get a diagnosis. So there are many factors driving an increase in diagnosis, but that still pales in comparison to how many more kids have autism and how much more severe autism is than when we were younger. So yeah, it's some percentage of it. And I think it's probably a reasonable percentage of mild autism. I think there are plenty of adults where they might have gotten a diagnosis a long time ago, but they just never did. And now they're hearing more about it, so they go get a diagnosis. But just by nature, those are individuals that are fully functional, that lived their life, didn't even know they had a diagnosis, and maybe had some idiosyncrasies or some odd behaviors, or did things differently, or were super smart or whatever, and or had some other diagnosis, but they function, like they're living on their own, they're doing okay. That's not what we're talking about. I mean, there are kids, correct, many kids, like 20 to 30% that have severe autism now and cannot function, and there's a large portion of those kids that are never going to be able to live on their own, and that's a big a big concern, and that seems to be rising. So I think there's no question that it's happening more. The question of why, I still think we don't know. I would assume it's our crappy food and too many toxins and some sort of mix of that. Just like you, I have seen kids that have autism with no vaccine. So I certainly don't think that's the only thing. It can't be. And I think the autism, the first problem is it's many things. I don't think it's one thing. I think we call it autism, but there are probably 10, 50, 100 different reasons why kids have some of those symptoms. And so I think that's why some kids without vaccines will still have it, because maybe they were exposed to something, an infection, a toxin, they have a genetics, whatever it is, that we call it autism. And then there are other kids that it's more environmental, that comes later, and maybe vaccines throw them over the edge, or maybe they get a vaccine just because kids get a lot of vaccines, that we start seeing their symptoms near after it, and you blame it on vaccines when it has nothing to do with that. That's what research is for. And that's what we should be studying. And when you have, I would say probably hundreds of thousands, if not millions of parents who have had a similar story at this point, they went in to get a vaccine and their kids had a reaction and things changed the next day. You can't say just because you had a vaccine this morning, had a heart attack this afternoon, that one thing caused the other. But if everyone's having heart attacks the same day they get a vaccine, you should probably look into it. And yes, you can't call these people anti-vaxxers. It makes no sense. These are literally people that went to get a vaccine and they feel like the vaccine caused these issues. They could be right, they could be wrong, but that is the data that you need to figure out what's going on. And you should be studying this, and you should be looking into these kids. And maybe there's a certain genetics or whatever that if you get vaccines, it causes issues. And we could figure that out over the next 10 years if we studied it appropriately. And that's what we should be doing. Instead of disregarding it, we should be listening to parents. We should be listening to what they believe, and we should be studying it so we have more information in a few years. And maybe for some kids, it does trigger what we call autism. And maybe there's a genetic pathway or whatever that those kids are susceptible to. And maybe we can know that before. And then those are the kids that don't get vaccines, or they get fewer vaccines, or one at a time. Like, why would we not want to know that?
Absolutely. And, those were some of the things that I was hoping would come out of this search by Maha, right? But instead, and I know they're still, working on it, but instead we get a rundown on Tylenol. I was so let down, right? I mean, the studies were already out there about Tylenol depleting glutathione and all of these things. I mean, it's good to bring to light for the public. I think that's good, great, whatever. But what you just mentioned, that's what we need to be looking at. And I was hoping that's what we would be getting out of this. What are your thoughts on this Tylenol situation? The big announcement, Tylenol causes autism, which I know that wasn't the actual announcement, but that's what people took home from it.
Yeah, it was bad. I don't know. It was the whole all around that was just it was not well done. It was not very science based. It was not portrayed it wasn't stated very well. And yeah, again, like you said, like I don't have any problem with talking about it. I don't have any problem with stating some caution. The studies are there. There have been many studies that have potentially linked Tylenol to autism, or at least associated with it. There have been some newer studies that didn't. We have explanations why it might not be related, but I think it's totally reasonable to say, well, like we should be cautious. There's plenty of studies that show that it might. We're cautious with everything during pregnancy, and so you shouldn't be taking Tylenol willy-nilly because maybe it's associated with it in young kids or in pregnancy, which is true of everything. So you really, I mean, that just gets back to the bigger problems in America of like we take a pill for everything when you don't always need it. So I think that's fine. Like, hey, maybe there's association, like think twice before you take this, make sure you really need it. But the way it was portrayed, the way it was discussed was bad. It just wasn't discussed in a really scientific way that really made a lot of sense for anybody, nor is Tylenol going to be the major factor when it comes to autism, even if it is related, which I'm not even sure that it is, but let's just assume that it is. And, it's a very one small piece of the puzzle. Okay, fine. That's fine. I don't have a problem acknowledging that if it turns out to be true, but that's just such a small piece of the puzzle. And to come out with that, to me, it was just so silly and such a missed opportunity, because what I was hoping was going to be done, and what I was really, I guess, disappointed, even when Secretary Kenny talked about it originally, when you start saying like, oh, we're going to have the answer, we're going to know. That doesn't make any sense. You're obviously not going to know in a few months because we don't know.
Right.
We know. So, I mean, the thing that should have been done, in my opinion, if I was in charge, would have been, this is important. We need to study this. We have done an extensive literature review, not by Mr. McCullough, by the CDC or whatever. And we have reviewed all the literature that we have on autism. And here are the top 20 things that we think might be associated. Here are the genes. Here are the factors that, here's the review. We are going to put $100 billion, whatever, some amount of money. We're going to study all these things and we're going to look into it and we're going to try to figure out which ones are most associated, what we can do about any of these things. Are there any treatments that we can be doing, anything preventive? Like, we're going to look at all these things. Tylenol could be one of those. That's fine. But, vaccines and genetics and this toxin and that toxin, like all the things that it could be, that's what we should be researching. So that way in 10 years, we have much better research and we have a much better picture of, all right, well, here are the 10 things you could do as a parent to minimize your risk of your kid having the diagnosis of autism. Like that to me would have been the announcement that would have been really logical and would have been very helpful versus Tylenol, which is like, I don't know, just kind of made them look bad.
Yeah. You say if you were in charge, could we see Dr. Gator in a political office one day? Is that something that might happen?
I mean, who knows? I mean, I'll be happy to be involved, but it's like, there's a very certain people that are involved in those things. So
Sure.
I don't know. If I was asked to help, I would help. I mean, I have done some stuff. I've been more involved in Maha stuff as much as I can, but yeah. I mean, it's a weird and crazy world, all the political stuff.
Yeah, absolutely. Okay, so and I want to be respectful of your time, but I want to get a little bit more information out there because people are confused. They need to know, what do they need to do with this information? So let's say, you're a parent and you're not pro-vaccine, you're not anti-vaccine. You just want your kid to be safe. Number one, where should they go to get information, good information, to make an informed decision? Let's just start there and I'll ask my next question after that.
Well, I would say, so there's a few things that I would say you want to do. First of all, if you have questions or you have concerns around vaccines in general, the first thing you want to do is make sure you're with a practitioner that you can actually have conversations with, because there are many doctors that are very unwilling to have these conversations. There are many doctors that, kind of just kick you out of the practice if you want to do anything other than the regular schedule. So you at least want to be in a place where you can have those conversations, you can ask your questions. So, if you haven't had a kid yet and you're interview before you go somewhere, if you are somewhere and you're not really comfortable, feel okay to switch practices. I think that's important because then you can at least have some conversations, which is a great place to a great place to start from. But ultimately, if you want to have more educated conversations, which will be really helpful, then I think you have to start reading a little bit. And it's unfortunate that you have to do that, but I think you have to start reading and understanding the landscape. I mean, I certainly try to do that with my book, but ultimately, there are many resources out there. And to me, what I've always told parents is you got to read more than one thing. You got to read something that's very, very pro-vaccine, CDC, like get that kind of narrative and understand where things are coming from. So you can read a Paul Offit book. They're pretty good in terms of that narrative. And then read something else, like read something that discusses the concerns that parents have, the issues that might be there. And then you can kind of have a landscape of where things are coming from. Like that's the way I tried to build my book, but I don't want to promote my book. I'm just saying, like, you got to read more than one thing. So there are books on history of vaccines, like Dissolving Illusions is really good. Turtles All the Way Down goes through how the research was done. Aaron Seary has a really good book that he just came out with about vaccines, and it's more like about the law of vaccines, but still really useful to understand kind of the issues and concerns that parents have. So I think if you first read about why vaccines are so great, and the benefits and why they could potentially help you, then you have that understanding. And then you can kind of read the concerns that some people have. And then you can have a balanced approach to asking questions and having some respect for what a vaccine might be able to do, but then also understanding of where the concerns might lie. And that will help you, I think, to balance these things for yourself. And as we were talking before, like, I can't tell you, or nobody can tell you what the long-term risks are from vaccines. So you don't know. You have to make a decision based on what you do know. And so ultimately you have to weigh the risks from the vaccines versus the risks of nature, and where everyone's going to fall on those things is going to be different. But at least you can understand like which diseases are around, what might kill my kid, what's not been in America for 50 years, what's the risk that my kid's actually going to get this, what's going on in my city, like are there, and then what are the risks that we do know? And at least you can then, if you're going to do a slow schedule, prioritize like, well, there's still a lot of whooping cough, so I'm going to choose that. Okay, there's a lot of measles, so I'm going to choose that. Oh, we haven't seen polio in 40 years. Well, maybe that's not the one I need to do first. So I think that's the way that parents kind of prioritize it. And if they're going to work on a slow schedule, then at least you can weigh the risks and the benefits based on what you do know, and you can make as educated a decision as you can. And that's what we do in the office, because I can't tell you what I don't know. So I can just educate parents on which diseases are most likely to kill their kid. And if you're going to choose to do vaccines, well, you probably want to prevent those ones versus something they're not even going to get. And that is the way that I try to balance it, at least.
Yeah. And, something I hear a lot is, well, we don't vaccinate, so we never take our kids to the pediatrician. And I don't like that. The pediatrician, I mean, you're a pediatrician, you guys are looking for so many things, and you catch things that the parent's not going to catch. I mean, I had someone in here not that long ago. I'm doing brain rehab, right? I was doing brain rehab on this kid. The kid had 2 undescended testicles. And that's not, I don't do that. I just happened to catch it when I was doing, his reflex exam. And I asked him about it. And they're like, well, we don't vaccinate, so we never see a pediatrician. It just stuff like that, right? That, like, there's so many reasons to take your kid and have established care with a good pediatrician. But how can someone evaluate a pediatrician? Because they're not going to say on the website, like, I'm okay with vaccinated, I'm not okay with I guess some do.
Well, they might.
Right. So, but what are some things? What are some red flags? What are some things that people should be really looking for?
Yeah, great question. So I'll echo the first part first. Is I agree. I mean, I think that doctors have a place for sure, and everyone has their place and their skill set, and you might not necessarily agree on all the medications or vaccines or other things, but doctors, of course, have trained a long time and are there to pick up the rare things that a parent's not going to pick up. So yes, if your kid's super healthy, do you need a doctor? No, not really. But the point of going to the doctor a lot of times, especially for well checks, is for them to pick up things that you wouldn't. And you think your kid's healthy, you kind of see them every day, but a doctor sees a bunch of kids every day. So we're trained to look for X, Y, and Z that you don't even know to look for. So I think it's good to have an established relationship, even if you don't go that often, but at least you go every once in a while, just to check in, just to make sure that you're meeting the milestones, just to make sure that there's nothing that is not apparent to you that might be apparent to them that needs more examination or work through. So that's why I do think it is very useful, number one. Number two, if you don't establish care with somebody, then you are going to have to do it in a scenario where you have a problem. And if something comes up, and that's not good. Like, you don't want to have to figure out where to go or where to take your kid or find someone that you can trust in the middle of your kid being sick. And if you never go to a doctor, if you don't have a doctor, then, like, especially if you're naturally minded, do you want to go to a mainstream office where they're just going to pump them full of a bunch of antibiotics when that's not even what you want? You want someone who's more integrative minded, who might think about other things, or at least someone that you can trust to be like, no, like, this is serious. You do need antibiotics today. Like, this is not the time to do, your supplement or your homeopathic. Like, you have a bad pneumonia, you need to do it. So having that relationship, I think, really helps in those scenarios, because ultimately, if you just walk into urgent care, they give you antibiotics, you're like, medicine, they don't need antibiotics. And then maybe they really did. Right. I do think that there's a good reason to find that doctor. And that to me is the red flags. Like, if you don't do that, then you're not going to have that established care for when you do need it. And it's not always that easy to find a doctor who's totally willing to let you be unvaccinated, but it's pretty easy to know which doctors are not going to let you do that. So, I mean, most offices now are very clear. If they only want kids going on the vaccine schedule, it'll be right there on their website. It'll be in the FAQs. Certainly, you should ask that as a question when you're interviewing. So interview, ask the questions. There are plenty of doctors that will let you go on a slow schedule. Not all of them, but many will. If you want to do none, then you have to do your research, ask around. You can find, there are places, but it's just not as many. So I think it's just researching, asking around, asking others that are naturally minded. There are plenty of Facebook groups and other things that you can ask, like, oh, I live in blah, blah, blah area. And where do you guys go for your kids who are more holistic minded? But interview, ask the questions. Say, I don't want to do vaccines. Are you going to be okay with that? And if they're not, they're going to tell you. And that's not the right office for you. So don't go there. Go somewhere else. If you want to do a slow schedule and they say that you can't do that, don't go to that office. You're going to be fighting every day. Go somewhere where they're okay with it.
Right. No, yeah, definitely good advice. Definitely should be interviewing your doctor, not just pediatrician, but any physician that you're working with. So let's end on a high note, or some good actionable information, right? So I love the information you put out there about living healthy and, how to prevent disease so you don't have to manage it and all this kind of stuff. So let's say, parents have these kids, what type of steps, what type of lifestyle changes, what should they be doing? And I know this could be a 2-hour conversation. I get that. So, but what are some key elements that we need to be walking through with our kids to ensure that they have, a good, healthy outlook on life?
Yeah. It's a big question, but I guess a high level, food, toxins, sleep, stress. I think those are the big ones. I mean, food, you have to read labels. We have to be thinking about what we're eating. We have to be trying to get as much real food as possible, fiber, fruits, veggies. Try to decrease the sugar, try to decrease the ultra processed food. I think, that's maybe the most important factor. We're surrounded by so many chemicals and toxins. So just being mindful of everything that you buy, and trying to minimize those chemicals and toxins, and making sure we're getting exercise. So nobody's outside enough, nobody gets enough sunlight, no one's moving enough, getting off screens. So I think those are the big ones. Obviously, we can talk about each one of those for another hour, but that, to me, those are the big factors that really are things that we can modify, they don't necessarily cost anything, and make a huge impact on pretty much every kid.
Absolutely. Just to kind of back up in life a little bit, people that are pregnant or about to get pregnant, any key, talking points or wisdom that you want to give those people? Because that fertility is a big problem now. And I think a lot of this needs to go into, family planning. And that, I know that's a whole nother discussion, but is there like a smoking gun, like, hey, if you're thinking about getting pregnant, do this now kind of thing?
Well, I think the answer is very similar, but when it comes to pregnancy, I would say most people don't think about it in those terms. Like, they don't think about, fertility being affected by all these things, or they don't think about their kids' health 5 years from now, in the sense of what they do today matters, but it really does. Like, if you want to have a baby in 2 years from now, like, starting to get healthy now, starting to eat better, decreasing your stress, all those things help because it regulates your hormones, it decreases your stress level. It's going to make getting pregnant easier. Obviously, like, being super stressed is not going to help you getting pregnant. I mean, we don't think about those things, but it's not like you can just turn off your stress one day. So
right.
I think if these are the things that you want to do in life, if you want to get pregnant and you're like, well, maybe not yet, but in a couple months, like, you have to start today, start working on things, make small changes. All of it matters, but you don't have to change everything. You don't have to never be stressed. You don't have to eat perfect all the time. But if you slowly start to improve your health, slowly start to decrease your stress, then it's going to make it a lot easier to have a healthy pregnancy and have a healthy child than if you don't. And it's, the more you can do, the better. And it's small things, but they add up over 5 or 10 years.
Absolutely. Well, again, I want to be cognitive of your time here. I truly appreciate you coming on. I love your viewpoints. I love your book. Like, truly, I love your book. I actually have copies of it in the waiting room, right? So I just, order them, like 5 to 10 at a time. I put them out. If someone wants to take it home, I say, take it, just take it home with you, and I replace it. That's how much I love it. So I really do appreciate that you wrote it. I love the way that you discuss everything in your book. I highly advise everyone listening to read it, keep a copy. I actually have a copy on my Kindle. So it's, if I'm on a plane, I can read it, and then I have a paper copy as well. So I truly appreciate it. Is there anything else that you would like to convey to the audience today before we sign off?
I mean, well, first of all, thank you for that. That's really kind. I would say it's not woo-woo to have questions. I think it's insane that we shouldn't have questions about something we're injecting, 30, 40 times into our kids. So many parents have questions now. Everybody's questioning vaccines. I think that's okay. It doesn't mean you shouldn't do it, but ultimately, I think you shouldn't feel bad if you have questions, and you shouldn't feel bad to ask those questions. And I think that the more that we do ask questions, the more that we are able to talk about it, then that's going to help to make improvements in the vaccine space. If nobody talks about it, if no one expresses their concerns, then there's no reason to ever make the vaccines better. And I think that's what we should be aiming for is a better program, a safer program, more research. And I think that's something that could be done if we come from that angle, as opposed to like, pro-vaccine, anti-vaccine. Those people are crazy. Like, no, if we come from safety and like wanting the best possible vaccines and the healthiest possible kids, then I think in the long run we can get there, and most doctors can get behind that. I think doctors today are kind of worried, like, if we find a problem with the vaccines, then no one's just going to vaccinate. And I don't think that's the goal of anybody. I think, or most people, I think the goal is they want safe vaccines. And so we can do that. And for me, that's why I try to talk about as much as I can. I try kids' health, but vaccines. And I do that on Instagram and at Dr. Joel Gator on X, on Substack. It's been really cool to see on Substack that so many people are interested. It's like one of the top health Substacks now. It's same name as my book, Between a Shot and a Hard Place, and it's risen near the top. And I think that's because people have questions and concerns, and they want to have discussions on health and vaccines, and we've never been able to do it before. So it's a great time to finally at least be able to have conversations, and hopefully that's going to lead to some safer products and more discussions and more research.
Absolutely. Well, we'll make sure to put links to all of that, your Instagram, your website, your Substack, all the things in the show notes so that people can access it easily. So again, truly appreciate you. Love everything you're doing for the world. Thank you so much for joining us today.
Thank you.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.